Another complication that can happen after the surgery is a deep vein thrombosis. So, what exactly is a deep vein thrombosis? When the patients are operated, they are in bed for a few days. So, what happens is there is a pooling of blood in the lower limb blood vessels. So, this tends to get uh, clotted and form thrombus. So this thrombus can theoretically dislodge from your lower limb veins and go in the lungs and cause a condition called as a pulmonary embolism, which can turn out to be life threatening. So how do we prevent this deep vein thrombosis? First is the early ambulation of the patient. We typically mobilize the patient within a few hours of surgery. We try to get them up and about as early as possible. So once the patient is mobilized, once they start moving their lower limb muscles, the risk of DVT is definitely decreased. Plus, we use either anti-embolism stockinets or we use something called as a flowtron pumps so as to help to improve the lower limb circulation when the patients are in bed. We also give some anticoagulants either in form of a subcutaneous low molecular weight heparin, or we give oral anticoagulants just to prevent the risk of blood clotting. So with the use of these drugs, with the use of these non-medical techniques like flowtron pump, anti-embolism stockinets, we reduce the risk of deep vein thrombosis. So these are the most common risk factors or complications that can happen after the surgery. But these are not so severe that you should not go in for surgery. Every surgery, however big or small, has its own risk factors or complications. But then that should not deter you from undergoing the surgery. So friends, if you have any doubts regarding any risk factors or any complications or as to how to avoid them, you can get in touch with us on the numbers which are mentioned below, or you can visit our website which is listed below. Thank you.